Module 1. What is the NCLEX RN? The National Council Licensure Examination, known as NCLEX. It is a mandatory exam needed by the Nursing Association to assess a candidate's eligibility for working entry-level nursing. Nursing candidates must have an accredited nursing degree and pass either the NCLEX RN or NCLEX PN to become licensed. This step is significant because it provides you with a method to validate your nursing knowledge and assess your ability to practice as a nurse. Think, would you want to treat a nurse who hasn't proved that they've followed these guidelines? Most definitely not. There has a purpose for the NCLEX exam. This exam will decide which nurses are eligible for entry-level nurse jobs. In your educational background, you will not give any similar tests. It's different. You learn information-based information and NCLEX test analysis and their applications in your academic background. This assessment will check your ability to figure out the critical problems. Before you can even consider scheduling or arranging where you want to take the NCLEX, you need to make your application to a province or territory. This exam is open for students who hold an accredited nursing degree. Why is the NCLEX so important? The National Council Licensure Examination is constructed to assess the capability and competencies required to perform as an entry-level nurse who is newly licensed. There are two types of exams available. Candidates who wish to become registered nurses will attend the NCLEX RN exam, and those who want to become practical nurses will take the NCLEX PN exam. After completing their school, nurses must advance to the next level before starting a job. To obtain a nursing license, all nurses must pass the NCLEX exam. The NCLEX is necessary since it removes any barriers between being a graduate or nursing student, and if this is your aim for your healthcare professional, you must pass the NCLEX test. The curriculum developed for Lincoln Technical Institute's nursing preparation programs, for example, is intended to prepare students to take NCLEX exams. As a result, direct practical experience training is provided, including simulations of laboratories and hospitals and real scenarios. Both practical nurses, PN, and registered nurses, RN, are given the necessary training to pass the exams. Qualified educators provide students with the tools they need to succeed. After passing the exam, these nurses are ready to work in public health organisations, hospitals, schools, doctors' offices, nursing homes, and wherever nurses are required. If you want a nursing licence in the United States and are already a nursing graduate, you will be able to attend the NCLEX RN test and give you a permit. Then you can work as a nurse in the United States with this license. Every test lasts about 2 to 3 hours, and candidates who do not pass must wait 45 to 90 days before retaking it. If you consider a nursing career, keep the NCLEX exam in mind while deciding where to attend school. A few colleges place a premium on preparing students for this exam because the license granted for passing is essential if you wish to work as a nurse. When it comes to taking the NCLEX exam, all students face tension and nervousness. However, you will understand how worthy your complex works are when you finish your exam. When you pass the NCLEX test and become a licensed, registered or practical nurse, you should cherish the confidence you've gained and be proud of your success. Who must take the NCLEX? Every NCLEX candidate interested in working as a nurse must take and pass the NCLEX test. The NCLEX test is divided into two types based on level of education. Candidates with a practical nursing diploma who want to become a licensed practical nurse should take the NCLEX PN. Those with an associate's or bachelor's degree who wish to become registered nurses, RNs, should take the NCLEX RN exam. How to register for the NCLEX RN. Your initial step is to apply to the National Council of State Boards of Nursing, NCSBN. You will need to follow the techniques established by the individual state boards of nursing. A few states have combined registration for the NCLEX RN exam with licensure applications. You need to send your application for your license, and that's how you will get a permit for all the states. You will contact a candidate bulletin to register for the NCLEX RN exam whenever you have applied. Your nursing school will send you 2 applications about 6 weeks before graduation, one for licensure and one for the NCLEX RN exam. On a predetermined date, you must submit the completed structures and the licensure fees to your nursing school. After receiving authorization to test, you should schedule your test date and time. Testing is available year-round, 15 hours per day, 6 days per week, in 6-hour time slots. To take the NCLEX, you must first get a nursing license from your state's governing nursing agency. If they conclude that you match the exam eligibility standards, you will be able to register to take the exam at that time. In your mail, you will notice that it will include another authorization to take the test, ATT. NCLEX RN exam and licensure fees. The expense to take the NCLEX RN exam is $200. The individual state boards of nursing are determining more licensure fees. Telephone registrants are needed to pay by Visa or MasterCard. In addition, there is a $9.50 administration expense for the telephone enlistment. If you like, you might send an individual check, cashier's check or cash order to the National Council of State Boards of Nursing. You'll get a postcard acknowledging receipt of registration, but you cannot plan an appointment to take the exam until your State Board of Nursing announces you are eligible, and you get an authorization to test, ATT, via the mail. Send your finished test application and fee to the National Council of State Boards of Nursing. In addition, you can enlist by telephone by calling 1-866-6496-2539 in the USA, 1-9526-813-815 for outside the USA, between 8 a.m. and 8 p.m. Eastern, Monday through Friday.